Hi all, my name is Dr. Kowal, and for starters, I would be quite happy if you all felt free to skip the usual formalities that we use at our LIFQHCs and feel free to just call me Sue-Ann. I'm going to begin by filling you in on how I became a part of our wonderful New Health family. There exists today a very different reality in healthcare, whereby it is quite necessary to consider the business of medicine and not solely the practice of medicine. So when my partnership group practice that I was a part of for over 25 years made the transition to becoming part of a health system, I embraced the attitude of, well, you know, when life throws you lemons, you make lemonade. And through a series of events, my practice is now in the hands of the LIFQHC here at SOC, and I have spent over 2 very happy years getting to know and working with my new health family. Throughout my career, I've been involved with school-based health and served several school districts here in Nassau County. Additionally, I am a state trainer for child abuse and neglect and travel throughout the state teaching a variety of related topics. I joined the attending staff at UMIC precepting residents, and in an effort to have young residents expand their perspective on meaningful ways to serve their health communities, I coordinated a program with the Freeport schools to have them join me there. And maybe the most unusual aspect of my focus is that as a dedicated triathlete with USA Triathlon coaching certification for adults and children, I developed a company called Health Powered by You, which engages in speaking, consulting, coaching, and writing directed at educating individuals, families, professionals, and organizations on strategies for achieving sustainable health and wellness throughout their lives. My special emphasis is to have a meaningful impact on the obesity epidemic. So in line with making lemonade, I have embraced this new period of my life as an opportunity to merge the many hats that I wear and expand healthcare through a variety of unique initiatives aimed at helping underserved communities. And these efforts include educating residents to think outside the typical healthcare box, working actively with the American Academy of Pediatrics and sitting on their Council of Sports Medicine and Fitness, the section on obesity, and the Council of School Health. I am writing and publishing articles and other related materials with the AAP at their parenting website, healthychildren.org. I run a blog on my website for healthy active living topics. I have produced obesity prevention webinars for parents. I'm actively working on an initiative which embodies current AAP recommendations for schools to encourage lifetime sports. And together with USA Triathlon, our goal is to set up triathlon programs for children in underserved communities here in the Northeast region. And now, as the Director of Pediatric Quality at the LIFQHC, my goal is to join with all of you and our staff to discover more innovative ways to continuously make the practice of medicine for the children that we serve something outstanding. Something that we can all be proud of and that brings us and our families great satisfaction. I am so very excited to have the opportunity to work together with all of you on the recipe and the production of the finest lemonade out there.